It's almost like they want us to forget that it was supposed to be called the Affordable Care Act, because it ended up not being affordable in the sense that people's costs of their premiums didn't necessarily go down. In some cases, it went up.
You're listening to the Son of a Physician podcast, brought to you by Tritel Concierge Medicine. This episode is about the overall brokenness in the way that healthcare is delivered, and how one doctor in Southwest Florida is joining the fight to change things. So first I want to introduce Dr. Tritel and ask him, where'd you come from, and how'd you get to this point in your career?
Well, I actually grew up here in Fort Myers. I finished my training at the University of Florida Internal Medicine in 1999. Initially out of my training, I went to work for a private practice group that was owned by a hospital. It was actually a hospital-owned group for the first 2 years. I practiced as a hospitalist at the Veterans Hospital in West Palm Beach, and I've also done a lot of work in hospice care. And that was on the east coast of Florida, and I've been back in Fort Myers since 2004. I was recently with a large multi-specialty practice, internal medicine associates, for about 14 years, and I started my own concierge medicine practice in January of this year, 2017.
And that was sort of in a response to you seeing some serious flaws in the way that healthcare is being practiced. And why don't you kind of give us a brief overview of what's broken generally and, why that is? Well,
there's so many things broken that, you kind of feel like, where do I start? But I think that if you look at what my specialty is, internal medicine, a lot of what you're doing is, if you're really practicing internal medicine the way it should be practiced, you're treating every one of your patient's conditions. You're looking at their blood pressure, you're looking at their cholesterol, you're looking at their blood sugar, and those things take time. It takes a lot of time. You have to look at each condition individually, and you have to assess it, come up with a plan, how to modify it, how to become accountable for it. And it is difficult to do when you're pressured for time. And I think that a lot of the problems really relate to the fact that we in private practice, you're what's called fee-for-service. And what fee-for-service means is that you're paid a certain amount per office visit. So if a doctor, just to simplify things, if a doctor makes a certain amount of money and his expenses go up by a certain amount, then he has to see more patients to make the same income.
The reason is insurance reimbursement, which dictates a lot of what is done in medicine. Currently, insurance will pay doctors only enough to justify a 15-minute appointment. How do they come up with this number? The answer is not completely clear, but probably comes from a decision made by Medicare in the year 1992. That year, Medicare adopted the following Relative Value Unit, or RVU, formula as a standard way to calculate doctors' fees. It goes something like this. Work RVU times geographic index plus practice expenses RVU times geographic index plus liability insurance RVU times geographic index, all multiplied by a Medicare conversion factor. The purpose of this now archaic formula was to reduce the variability in physicians' fees. Based on this formula, a typical primary care office visit should be 1.3 RVUs, which, using the American Medical Association coding guidelines, at the time translated to 15 minutes. Medicare then set its reimbursement rules based on this length of time. Private insurance companies followed suit, managed care took over in the mid to late 1990s, and medicine was no longer the same. Because of this series of events, nowadays, 15-minute doctor's visits have become the norm, with no apparent change on the horizon. But that's 15 minutes total dedicated to a patient, and the bureaucratic nightmares of paperwork take about half of that time, which in private practice can only be done by the doctor, so that's where you get the 7-minute doctor visit from. But times have changed, supposedly, and Americans keep getting promised solutions to the crisis we're in, and people are giving up hope. Can we even start to fix it without confronting the nature of the dysfunction? The Affordable Care Act didn't lower cost. They've increased by double digits every year.
Well, I don't think we've addressed some of the underlying issues regarding the cost of healthcare, and yeah, I mean, it's been a disaster in terms of the notion that somehow it was supposed to reduce the cost of healthcare, and I think ahead of time, a lot of people realized that you're not going to increase the amount of people that you're insuring and increase the quality of coverage and pay for preventative care and a lot of other procedures and then turn around and say that it's going to cost less money. So, there's problems because things like research and development, I mean, they cost money. But if they're going toward researching a drug, when the drug company puts a label on the drug and puts it on the shelf and it gives it a price, all that stuff is going to be factored into it. As the cost of health insurance, of health care in general goes up, the cost of your health insurance is going to go up. And I think also the Affordable Health Care Act it's funny that they don't call it that as much anymore. They call it Obamacare. It's almost like they want us to forget that it was supposed to be called the Affordable Care Act because it ended up not being affordable in the sense that people's cost of their premiums didn't necessarily go down. In some cases, it went up.
And their deductibles went up too. Like way up.
For some of the plans, it did. Some people were better off going into the private marketplace. I think there were some pretty favorable things, though, that were done and that were looked at, things that were avoided for a long time. And one of them was when an insurance company would come to you, and let's say you're 55 years old and you've had diabetes for 30 years and you have your own plumbing company and you want to apply for health insurance, and they turn around and say, well, you're not insurable. They could just decide, we're not going to even give you the possibility, or we're going to charge you $3,000 a month or something ridiculous like that. So it did try to make the insurance companies more accountable in terms of offering insurance. It also forced them to pay for some preventative healthcare services, which some of the insurances were not doing. And so those were obviously positive things.
People come here to retire. They're obviously a little bit older. What challenges does that present to healthcare providers?
Well, Southwest Florida is a great place to live. I grew up here, but now there's a lot to offer. There's a lot to do entertainment-wise. And so a lot of people are choosing to call Southwest Florida their home because of that. And most of them are coming to retire. So what that means is you've got a much larger patient population that's skewed toward an older demographic. And the people that are an older demographic are obviously going to be people that have more health problems. I mean, you're not going to say that 100%, but for the most part, when people get older, they have more health issues.
Southwest Florida is one of the fastest growing regions and one of the fastest growing states in the nation, according to U.S. Census Bureau data released in May of this year. The Cape Coral-Fort Myers metro area's 3.1% growth rate was the second highest in the state and the fifth highest in the nation, according to census figures. The metro area grew by 22,051 people between July 1st, 2015 and June 30th, 2016, and now has a population of 722,336. 25% of the population is over 65, and our population is expected to grow to 754,815 by 2020.
It is very difficult and stressful because you say to yourself, I want to perform the quality of care that I need to. And how in the heck am I going to treat Mr. Jones's blood pressure, cholesterol, blood sugar, his weight, and because of his weight, he's having back pain. And then he's having sleep apnea because he's overweight and he's not sleeping well. And his wife's kicking him out of bed. And those are issues that take a long time to treat. And when you're in private practice, like I was before, you have an overhead which is so high, and you're being paid by Medicare and insurance companies. And when you work for Medicare and insurance companies, you're paid by what's called fee for service. And fee for service means that you get paid a certain amount for an office visit. And it's going to vary a little bit depending on how it's billed and coded, but it puts a tremendous amount of stress on you if you're trying to provide that type of quality of care and you're seeing 20, 25, or 30 patients a day. And those were things that I struggled with for many years.
Because in that average 7-minute time slot that you're seeing a patient, there are an infinite number of factors that affect their health that you're not talking about, correct? And so you're by definition, you're just not giving them the time that they might need, especially with the older cases, the older people whose the complexity of their cases is greater, correct?
Well, yeah, I mean, it's funny, I've heard the 7-minute average recently, and I'm not sure if it's completely accurate or not. I don't think I was ever in and out the door that quickly, but if you're not doing it, in terms of the 7 minutes, you're spending those 8 minutes either at 9 o'clock or 10 o'clock at night by catching up on the paperwork. But yes, it's in terms of trying to cover all those different things that I just talked about in 7 minutes, it's impossible. And I think that number that you're quoting, the amount of time that each doctor is spending with the patient, has been reduced more and more because of the rules and regulations that the hoops that doctors have to jump through to follow all the rules and regulations that are set by Medicare.
The details of one's health can fall through the cracks in a 7-minute visit. How so?
Mental health is one of the most common things in Southwest Florida. It's just deplorable, the lack of care. And yet another thing that falls upon the primary care physician to do. And
it has all these other externalities if it's not treated, right?
No question, yeah.
Yeah.
And the quality of your life is poor. Not only the increased risk of almost every type of health condition there is, but reduced quality of life, increased risk of suicide. It's going to affect your relationships with other people. But there is not a lot of psychiatrists in the area that accept health insurance in Southwest Florida. There's not a lot of them. And the ones that do are in the same situation that the primary care doctors are in. You're pressured for time if you're accepting health insurance. Your overhead goes up, and you have to have a higher volume in order to have the income that you want. Well, I understand what you're saying, and I think, just to relate what you're saying, to what we're talking about, that there's a couple of examples that I can use which may seem unrelated but are totally related. Let's look at blood pressure and let's look at depression, okay? I see somebody for high blood pressure. I have 7 minutes with them. I say there's a great pill. You take it once a day. It'll fix all of your blood pressure problems. Come back and see me in 3 months. And sure enough, I give you the pill. You come back in 3 months. Your blood pressure is good. But you might not be thrilled with the fact that you're taking a pill or that you feel like you become dependent on something. You didn't realize that if I had more time to spend with you, that we could have talked about your aerobic exercise. We could have talked about weight loss and given you more specifics on how to get there. You didn't know that the sunflower seeds you were snacking on because they're nuts, they're so healthy, but you didn't think about the fact that the amount of sodium that was in them was enough to raise your blood pressure. So when I use that as an example, I'm using blood pressure because I'm looking at the treatment of it two different ways. You're treating it in 7 minutes, or you're treating it in a manner to where you're actually able to be preventative, possibly in the first place, or even treat it in its early stages. Now, I talk about depression. When you have 7 minutes, you may not even know that they have depression. I mean, you might miss the boat in the first place. And what's even trickier about it with depression and bipolar is even harder, because people don't go to the doctor when they feel well. So if they're manic, they may not go to the doctor. But even if they go to the doctor, they may not bring up that they're depressed. So the patient's wife might tell you that. But in general, it's kind of last on their list. So if you are lucky enough to diagnose somebody with depression, or I should say they're lucky enough to be diagnosed, let's get back to the 7-minute visit versus the 30-minute visit. So in the 7-minute visit, you say there's a new medicine out there. It's called Cymbalta. It's better tolerated than Prozac because you don't have as many side effects. You don't gain as much weight. Take 1 pill a day. You might have some side effects, which I don't have time to go into. Take this pill and you'll feel better. Well, at least that person was lucky enough to get diagnosed, but they don't know much about this pill that they're taking. They wonder, is this something dangerous? Is this something I'm going to be addicted to? Is this something that's just going to dull my problems? And when you know somebody on a personal level and you have a relationship with a patient, there's a lot of things that are going to become readily apparent right off the bat. When you know somebody, you're going to know that something's wrong. You're going to know them over a period of years, to where you can sense things maybe earlier on when you have a longitudinal relationship with a patient. But even just the fact that when you get into this 30-minute visit, you can get into maybe their upbringing a little bit. You can get into some of the physical signs and symptoms of depression, sleep, diet, exercise, and substance abuse is always a big issue. The number of patients I've had over the years who tell me I have a drink at night to help me relax. And I saw David Essel had a piece on that recently, that people have a drink to help me relax, but in fact, alcohol increases anxiety. Alcohol reduces the quality of your sleep. So all of those things can affect your depression, can affect your mental health. It's not going to happen in 7 minutes.
One objection to concierge medicine is that it leads to a two-tiered system in which the affluent get attentive care and everyone else doesn't. But that's simply no longer the case in 2017. Concierge, or direct pay care, is working at many different prices and is more and more targeted to middle-class patients. There are already many more than 2 tiers of healthcare: the county system and Medicaid for indigent patients, private HMO insurance, staff model HMOs, PPOs, direct pay practices, etc. How many tiers are there in other marketplaces like food, housing, or clothing? A practically unaccountable number. One characteristic of robust marketplaces is that they offer goods at widely varying prices. That means that those who need to save can still afford some access to the marketplace, but those that can afford more can get better comfort or quality or more reliability. You can get across town for a price of a bus ticket or the price of a BMW. There are a lot of different tiers. The main reason concierge medicine isn't growing faster is that the insurance model is so entrenched in our understanding that we now think of getting routine care through insurance as the regular way it works. We don't even have a name for it anymore. If someone says, "I saw my doctor," we just assume that someone else paid for it. If she says, "I saw my concierge doctor," we understand that she paid herself. But it should be the other way around. We don't have a word for an accountant or a plumber or a lawyer who gets paid directly by his clients. They're not concierge accountants or concierge plumbers or concierge lawyers. We need to get to the point that paying a doctor directly doesn't deserve an adjective before the noun medicine. Paying your doctor is just medicine. Having someone else pay for you is insurance medicine. So how has business been for Dr. Tritel so far in 2017?
It's been amazing on so many levels. And my wife Lisa and I have both just found it tremendously rewarding, and the staff that we have working with us as well. People have just been so positive in their praise about how much they've enjoyed it, and you just see examples day in and day out of things that happen, and it's. I think that people are so set in their mind about what it is when they go to the doctor. I mean, if you're, 50 or 60, it's been the same thing since you were a little kid. You walk into like this cold, sterile environment with the hard tile floors, and you go and you sit in the waiting room for over an hour, and the old grumpy doctor comes in and gives you a shot. I mean, it's not really your positive image that comes to mind that says, "Oh, I can't wait to go to my doctor's appointment." You know, it's a negative thing, and it's something that people. It's hard for them to imagine how different it could be in an environment like this.
Okay, so in closing, this podcast for your patients. It's for other people in the outside world.
Right.
What's your best advice for people and how they should seek healthcare?
I always would tell people to think about all your questions ahead of time and write them down, and make sure that you answer the questions at the beginning of the office visit, and write the important ones down first. Because you don't want your appointment to be over and your doctor to be out the door and you to have your questions. So I encourage people to write your questions down, take notes, and don't be afraid to ask your doctor why. I mean, I don't think doctors, we don't like it when people want to argue about everything, but you have the right to ask questions and be your own advocate.
All right, well, thanks for your time, and this is episode 1, so we look forward to hearing from you in the future.
Okay, sounds good.
You've been listening to the Son of a Physician podcast with Dr. Paul Tritel. To learn more about his practice and why the next generation of healthcare is actually the old-fashioned way, visit tritelconciergemedicine.com or call 239-244-9670.